All right, folks, we're back for another video where we're going to focus on the muscles of the pelvic girdle, the hip, and the leg. So, of course, get your good old muscle list out. And as you can see, our third group is going to be muscles of these regions, right? And the ones that are going to be in bold, we need to learn the origin, the insertion, the function, and location of. So, for example, like gluteus maximus and gluteus medius, we have the origin, insertion, action, which is also the function, interchangeable, and also the location of these different muscles. The ones that are not bolded, we just need to know the location of. Let's go ahead and get started with the gluteus medius, gluteus maximus, and gracilis. All right, so let's go ahead and get ourselves oriented. We're dealing with the gluteus medius, gluteus maximus, and gracilis muscles. So just by looking at it, you can see the gracilis muscle is going to be probably in the inner thigh, the inseam of the inner thigh. We'll see that there. And the goal is to just know the location of it. So you can say that it's near the inseam or it's in the most medial portion of the thigh. That will be the location for that one. And that's all we have to know about the gracilis. But of course, I want to add a little bit more details. I mean, if you think about the gracilis muscle, you go ahead and try to squeeze your legs together, then that is going to allow the hips to adduct. Okay, so the hips are going to adduct, and it also can help flex your knee a bit. So again, squeeze your thighs together, trying to basically force them to go more medial. Okay, and you'll see that you're dealing with the gracilis muscle in that way. Now, gluteus is going to be dealing with the glutes, which you know is going to be our rear end. So we have the gluteus maximus and medius. Maximus means it's going to be the larger muscle. Medius means it's going to be the smaller muscle. So when I think of the gluteus maximus, I, of course, think that is going to be the buttocks, right? That's going to be the larger muscle in the buttocks. But if I were to take or remove the gluteus maximus, then I'll be able to really see the gluteus medius. So the gluteus medius is going to be deep to the gluteus maximus. That means it's underneath it. Now you can see it here a little bit, but I have to remove the gluteus maximus to be able to see fully the gluteus medius. Now the gluteus medius is basically going to be like a side hip stabilizer. And the location of it is going to be the lateral hip, see here, and again, deep to the gluteus maximus. You can also say it's the side hip. And really it's the upper and outer butt. That's one thing to say as well. Whereas the gluteus maximus, as you can see, is going to be all about the buttocks here, so a larger muscle, so it's easier to be able to, again, touch because it is superficial. Now let's get into the origins of the gluteus maximus. So the origin is going to be the dorsal ilium, or the posterior ilium, okay, the back of the actual ilium, the sacrum, and the coccyx. So that's where that origin for our gluteus maximus is going to be. The insertion is going to be at the femur, so you'll see the insertion go all the way down here. It's going to be at the gluteal tuberosity of the femur and the iliotibial tract. So we have this large band here of connective tissue, and that's the iliotibial tract. So yes, we're going to have insertion in that area, and also, again, in our tuberosity of the femur. Now, what is the action of the actual gluteus maximus? Well, really, it's a hip extender. It's going to help with external hip rotation and hip abduction, meaning away from the midline. When we talked about the brachialis, we're going towards the midline, so that was adduction. Talking about gluteus maximus, that's going to be dealing with abduction, so away from the midline. And this iliotibial tract, we'll talk about as one of the other structures of muscles that we focus on, but I did want to bring this up here because there is an insertion for the gluteus maximus on that iliotibial tract. Okay? It's really like a band. Now, gluteus medius, on the other hand, its origin is going to be the lateral surface of the ilium. So again, it's going to be the side of that ilium here. So that's going to be the origin. And then when we talk about the insertion, it's going to be the greater trochanter of the femur. So we have our femur here, and you'll see the insertion for the gluteus medius, is going to be near that trochanter of the femur. And we won't be able to see that well until we get to our app, so we can actually see more details and pull away the superficial layer where the gluteus maximus is. All right, folks, so now let's go ahead and get into our overall function of the gluteus medius. Again, it's going to be all about hip abduction. So it's going to help move the hips away from the actual midline. It's going to help medially rotate the hip, keep the pelvis level. And again, it's going to be basically there to help with weight bearing as well, keeping things stabilized. Easy to feel the gluteus maximus, like I said before, superficial. If you really want to feel the gluteus medius, you can basically stand on one leg. Stand on one leg, you'll be able to feel that gluteus medius on your side hip there. And that should be easier for you to do. Now let's go ahead and get a visual of these muscles. The skin, we're going to take a layer off, and we're dealing with the superficial layer. So yes, we can see our gluteus maximus here. Go ahead and highlight it, gluteus maximus. So again, The origin is going to be that ilium, the dorsal, the back of the ilium, the posterior of the ilium, the sacrum, and the coccyx. And the insertion is going to be that tuberosity of the femur and also the iliotibial tract or band that's going down from the hip to the knee. I took another layer off so that it's easier to see the gluteus medius, okay? Now again, we're going to have an origin at the lateral surface of the ilium here, this lateral surface, and our insertion is going to be the greater trochanter of the femur. So we finally get to see more of the femur. We have our insertion here where the greater trochanter is. Now, in order to see the gracilis, we have to basically look at an anterior view. So let's go ahead and look at that. All right, so here's the anterior view. As you can see, it's going to be on this very slender muscle that's going to be in the inner thigh. It's basically a thigh adductor at this point. It's going to adduct the hips and also helps flex the knee a bit because that's going to be a part of some of that stabilization of flexing the knee. All right, I now also want to focus on the gluteus maximus again so we can see extension at the thigh and hip joint. See? Maybe our gluteus maximus helping us with that. We also can see our gluteus maximus that's going to be helping with lateral rotation of the thigh at the hip joint as well. Again, and this is, of course, a posterior view, just to keep that in mind. We see our gluteus maximus, we turn, and we have a lateral rotation of the thigh at the hip joint. We can definitely see that it's starting to contract. So let's just visualize that again. All right, see that there. Go ahead and move on to the muscles of the actual quadriceps. So I mean, since it's quadriceps, it's going to have 4 heads, 4 organs that we're looking at. And it is really 4 different muscles, and these muscles come together to form the quadriceps. Rectus femoris, and this is going to be basically the straight head of the quadricep, and it's going to cross the hip and knee, and we'll see that as well. The tendon is cut here, so I want to show you a better view. And then we have the 3 muscles that most people usually think of when they think of the quadricep. But remember, it's the 4 muscles, rectus femoris, and then also the vastus muscles. So we have the vastus lateralis, which of course is going to be the lateral quadricep muscle. As you can see here, it's on the lateral side of the thigh. Vastus medialis, which is going to be towards the middle. And then vastus intermedius, which is going to be in between the lateralis and medialis. Now, vastus intermedius is not on your list, but I still want to put the action down here just so you kind of remember that there's 4 muscles a part of the quadricep. So when you're thinking about location here, we're thinking about the thigh muscles. We see that we're dealing with the femur for a lot of the origins here. And also we have our insertions around the tibia. We also have insertions around also that patellar ligament. So it has to do a lot with flexing or being able to extend the knee. So that's when you're thinking of quadricep, being able to extend the knee. Let's go ahead and get visuals of this first because we don't have a perfect visual for rectus femoris, and then we'll move on to some more detail. All right, I'm focused on the thigh muscles here, and as you can see, I have an anterior superficial view. And remember when we saw in our visual that the rectus femoris was cut at that tendon? Well, that's because it was basically the upper layer. Right after the skin, you saw the rectus femoris. So that's going to be our superficial layer. And it was cut so that we can see the other vastus muscles underneath that helps us complete the quadricep. Okay? But now it's not cut here. Let me take this off. And as you can see, here's our rectus femoris here. And it kind of goes down into the patellar tendon. And you'll notice that when we start learning about other structures, it is also called the patellar ligament. So that's the only time you'll see ligament and tendon kind of crisscross a little bit. So here's our patella here, and we have our overall patellar tendon. Here's some here as well. We kind of was cutting it around here on our visual. We also can see the rectus femoris here, as you can see on the cadaver. The origin and insertion for our rectus femoris. Well, first, we know it has to do something with the iliac spine, and we also see that it's definitely going to be part of that acetabellum. So let me go ahead and move this up a bit. There we go. So yes, we're going to be having an origin around the iliac spine, and really you're going to be looking for the inferior iliac spine and then go above it. That's going to be where one of the origins is, and also the acetabellum. So remember, the acetabellum was going to be where all of our coxal bones or hip bones form that kind of deeper groove, so we can actually have a better ball and socket joint that has a lot more stability for our femur. Well, yes, we have an insertion area or a little bit of the margin of that insertion area for our rectus femoris. Now the insertion is going to be down in the tibial tuberosity. So it's going to be through this ligament, or again, patellar tendon, that's going to be connecting to the tibial tuberosity That's how we're able to, again, have the insertion be that long going down into the tibia through that patellar tendon. Now, what is the purpose of this? What is the action? What is the function of it? It's going to help with hip flexion and also knee extension. Now, when we look at the videos where we actually have movements happening, we're going to see the quadriceps as a group versus individual muscles. So you're going to see knee extension happen a lot. But we also have hip flexion, and that's going to be something that the rectus femoris does. Now, let's move on. We now took away that superficial layer that has the rectus femoris. Now let's get down into the next layer, which will allow us to see our vastus muscles. Again, our quadricep, other quadricep muscles. So let's talk about the vastus intermedius, because again, that's the one we don't really focus on as far as it's not on your list or something you have to memorize, but it is a part of the quadricep muscles, so why not? Here's our vastus intermedius. As you can see, it's in between our vastus lateralis and medialis. Okay, so that's the intermediate in between the two. Now, as far as its origin and insertion, you don't have to worry about, but what you do want to know is that this particular quadricep muscle is going to help with knee extension. Knee extension, knee extension. Why? Because via the patellar ligament, or again, the patellar tendon, we're able to extend all the way down to the tibia. So we want to keep that in mind. That's going to help us with our knee extension. Our vastus medialis, which I have highlighted here, and some folks might be saying, wait, hold up, why does it look different? That's because we're looking at the right thigh. Now we're looking at the left thigh, or your left, for example. So now our thigh muscle here is part of the quadricep. This medialis means that what? It's going to be in the inner quadricep. And it also kind of has like a teardrop shape. On the cadaver, you'll see it a little bit better, but it does have like this teardrop shape. And that's something that can help you remind you that it's the vastus medialis. So what's the origin? Well, it's usually going to be lines of the femur. So we have the linea aspera and also the intertrochanteric line. Remember the trochanter, the greater trochanter of the femur? There's a line there as well, and also a line down the shaft of the actual femur, and that's going to be where you have origins for the vastus medialis. And then as far as insertion goes, again, through the patellar ligament / patellar tendon, it's going to go to the tibial tuberosity, so all the way down to the tibia. All right, let's go to our vastus lateralis. Again, it's going to be lateral on the side here, as you can see, and it's just basically this big outer quad. And the whole origin of it is still going to be on the femur. So we're going to have an attachment to the greater trochanter of the femur and also the intertrochanteric line and the line aspera as well. So again, attachment to the femur, attachment to the femur. And guess what? Its insertion is going to be all the way down where the tibial tuberosity is via what? The patellar ligament, also called the patellar tendon for this particular region. Okay? So you can say that the vastus lateralis is going to be the lateral thigh. Vastus medialis is going to be, again, the medial thigh. And, of course, the rectus femoris, which is superficial, is going to be the anterior thigh. And then we have the vastus intermedius, as you can see here, which, of course, is the intermediate between the medialis and the lateralis. Okay? Now, the whole purpose, the action of both the vastus medialis and the vastus lateralis is to extend the knee. So, again, extend the knee. Extend the knee for the vastus intermediate extends the knee. The lateralis and the medialis extends the knee. The rectus formis is going to extend the knee. But the rectus formis also does hip flexion. So first, let's look at what all of our quadricep muscles do, and that is going to be extension of the leg at the knee joint. So we see our vastus medialis, our lateralis, and of course our rectus femoris. The intermedius, of course, you can't see. You would have to remove the rectus femoris. And that's how we're going to be extension of the leg at the knee joint. Now remember we said that the rectus femoris only can also flex the thigh. Let's see that. So this rectus femoris only is going to be able to flex the thigh. There we go. See an injection at the vastus lateralis. And just to let you know that this is going to be an injection that you normally see with infants and children up to 2 years old. After that, then of course you can go to the deltoid, and we'll talk about that when we get into intramuscular injection. Let's move on. Our next set of muscles is going to be the semimembranosus, the biceps femoris, and the semitendinosus. Okay, so you can go ahead and find those here. The biceps femoris, As you can see, I'm just looking at two different words trying to say two different things. These are all going to be a part of those hamstrings. So we have the biceps femoris, we have the semitendinosus, and the semimembranosus. Okay. there, side of my head. And then we also have the cadaver version here. Let's go ahead again and look at different views of it, and then we'll talk about some of the origins, because all of these are going to be basically bolded. So we need the origin, insertion, action / function, and location. All right, folks, we have the posterior guide here. And again, we're going to be focusing on the hamstring muscles. So first, let's think about the bicep femoris. We know it's going to have two origins or two heads. And let's look at the long head first. The long head origin, as you can see here, is going to be that ischial tuberosity. Okay. And then we're also going to have the short head, which is going to be more of the linea aspera. So it's going to be a line on the actual femur. Our long head of the bicep femoris, it is kind of hard because we see that we have our femur, we're going to have our hip bone here, and then we should have the ischium here, and we don't see the full extension. So the long head of the bicep femoris is going to go all the way to the ischial tuberosity, which kind of, again, this little bony projection on the bottom of that ischium. Okay, and then the short head, if we go back there, is going to be the line on the femur itself. And both of these origins are going to have an insertion. As you can see, we're both going down to the same area, right down below here. And that insertion is going to be the head of the fibula. And of course, you can also say lateral tibial as well. So let me go ahead and show you that. I've sort of moved down. I'm looking at the short head of the bicep femoris, but even if I was to look at the long head, they're all kind of have an insertion at the bottom portion here. So yes, it is going to be inserting at the actual head of the fibula. And you can also say the lateral tibial, but it's really only going to be the tibial condyle. So remember, the condyle is like the knuckles of the end of an actual bone, like little knuckles. And so the lateral portion of the tibial condyle and the actual head of the fibula is where our insertion for the bicep femoris is going to be. Now, what's the whole purpose of this? Well, number one, the whole focus or the function of our action is that the long head, we see here, is going to help with hip extension and knee flexion. Okay? Where the short head, let me go back to this, is going to help with knee flexion only. So again, we have a situation where we see the longer head is going to help with hip extension along with knee flexion. Now, where is this located? As you can see, it's located in the posterior lateral thigh. So I can see that this is going to be my thigh here. Let me go ahead and go back to the original layer. We have our thigh here, so it's going to be on the back of our thigh, the posterior of our thigh, and also kind of towards the side. So let me go ahead and show you how it's going towards the side here. Short head is also towards the side, and they both come together to form the bicep femoris. And sometimes folks call this the two-headed hamstring because, again, the longer one here, the shorter one here, they all come together to have that one single muscle, so you can see that as well. Next, let's get into the semitendinosus, because this is going to be in the same kind of level of the actual layer that we see here, semitendinosus. Orient ourselves. We have the long head of the bicep femoris. Okay, this is one layer, but we have to take a layer away to be able to see the short head of the bicep femoris. So again, the short head of the bicep femoris is going to be another layer underneath, but of course they're still connected. Now, back to the long head of the bicep femoris. In order to see the semitendinosus, it's basically right next to that bicep femoris. So here's our bicep femoris. Right next to it is going to be the semitendinosus, again, part of the hamstring. Now, what's the origin for this? The same as the bicep femoris long head, which is going to be the ischial tuberosity, that bony process coming at the bottom of that ischium there for your hip bones. What's going to be the insertion? Well, it's definitely going to be near the tibia, right? But where is it located specifically? It's located medial aspect of the upper tibial shaft. So we have the upper tibia here. It's in the medial aspect of that upper tibial shaft. Okay, some folks will just say, I know that the origin is the ischial tuberosity, and I also know that the insertion is the upper tibia. Boom. To help your brain at least get those details out. But again, I would make sure you ask your lab professor what the details that you were expected to know. Okay? For my exam, if you put that it's going to be at the ischium for the origin, and if you put that you have the upper tibial shaft as the insertion, I will accept that because I know you're just still learning. And of course, depending on where you're going in your life, you still are just going to be layering this information on as you continue on in different courses. Now, what's the whole purpose of this semitendinosus? Well, we already said that for the bicep femoris, we have the long head that can do hip extension and knee flexion, and the short head can only do knee flexion. With the semitendinosus, it has the ability to do, again, similar to the long head of the bicep femoris, hip extension and knee flexion. Okay? Now let's move on to the semimembranosus. Now, as you can see, we had to take another layer away so that we can see this. Okay? There we go. And guess what, folks? Where's the origin for the semimembranosus? It's going to be the ischial-tuberosity. So the long head of the bicep femoris, the semitendinosus, and now the semimembranosus is all going to have an origin at the ischial-tuberosity. Meaning, again, the back of that ischium is going to have a little bony process, and that's where they're going to attach. Now let's think about where this is actually going as far as the insertion. So we have our origin here. Go down to the insertion. You might think, oh, it's the same as we saw for the semitendinosus. Well, it's a little bit different. This is going to be the medial condyle of the tibia. So instead of going mainly to the shaft of the tibia, it's going to be at the medial condyle. So remember, a condyle is going to be like the knuckles, the end, the articular cartilage at the end of bones, right? It looks like little knuckles. And so at the medial condyle of the tibia is where you're going to have the insertion for the semimembranosus. But guess what? Its action is going to be similar. Hip extension, knee flexion. Hip extension, knee flexion. So you see that hip extension and knee flexion, that's what all these hamstring muscles do. But when you're talking about the short head for the bicep femoris, it is only going to be able to do knee flexion only. Now, locations where we're going to have maybe a little bit of trickiness here. So back of the actual posterior or lateral thigh, you can definitely see the bicep femoris. Even the short head, you'll see it on the lateral thigh. Semitendinosus is going to be mainly in the posterior thigh. It's also superficial. So it's going to be kind of like the back inner thigh. And then semimembranosus is going to be near the back of the knee. Okay, so that's one thing. You see the one that's near the back of the knee. We also know it's going to be deep to the symbitendinosus. So it's underneath the symbitendinosus. You can't automatically feel that. And that's where your semimembranosus is going to be. Now, you don't have to use the app thing that I'm like showing you. You can also just use the visuals in your textbook. But of course, the best thing to do is get hands-on from the lab itself, right? I so wish I was there to teach you guys hands-on because it's just so much fun to see it visually and be able to pick up muscles and really just get into it, you know? But I'm pretty sure you're getting that same level of love from the other lab professors. So don't think I was being shady. Now, again, all the stuff we talked about here, the origin, insertion, action, and of course, location for these hamstring muscles, we've already spoken about as well. Again, go through them. For the ones you have to remember, I believe in total, based on the muscle list, there's about 19 you have to know the origin, insertion, action/function, and location of. And you can use specifically, of course, pictures, visuals, being able to try to feel things that are superficial the best way you can, and be able to kind of use a note card to say like semitendinosus on the front and then on the back, right? The origin, insertion, action/function, and location. Let's move on. Now we're going to get into the calf muscle. Okay, there's going to be the superficial calf muscles and also the deep calf muscle. So let's go ahead and get ourselves. Well, let's see how this PowerPoint looks. All right, we're back in the game. So as you can see here, we have a side view of the gastrocnemius and the soleus. Those are going to be the two calf muscles we focus on. But we also want to see the posterior view. That's going to be easier for us to see. So the gastrocnemius has a medial head and a lateral head. You can see this is going to be the medial head here, the lateral head here. And these are going to be very superficial. So sometimes you'll see this be called two-belly calf, the two-belly calf, okay? And this is going to help us bend the knee. You can really feel the belly of that calf. That's going to be your gastrocnemius. Now we have our soleus. As you can see, I had to cut away the gastrocnemius in order to be able to see the soleus. So what does that mean? It means that the soleus is deep to the gastrocnemius, or again, it's underneath the gastrocnemius. You have to remove it so it's not superficial. The one you can feel superficially is going to be the gastrocnemius. Okay? Let's get into detail of this. So our soleus is going to be, again, deep. Let's talk about the one that's superficial, gastrocnemius. First, we have two heads, the medial head and the lateral head. And as far as the overall origin for the medial and lateral head, it's all going to be on the condyles of the femur. So the condyles of the femur itself. And of course, because we're at the calf area, we're talking about the condyles of the femur. That's going to be, okay, our knee joint here, we have our femur, and at the condyles of those femurs, we'll be able to see the origin. Okay? And for the insertion, it's going to be the Achilles tendon. So we have our calcaneal tendon here, and that's where the insertion for the gastrocnemius is going to be, or this larger calf muscle. Okay, folks? Now, what's the whole purpose of this? Well, it's going to allow for ankle plantar flexion and, of course, knee flexion. So just keep that in mind. Also, this is what's going to tighten when you do calf raises. When you try to raise your calves, like we said, with that second class lever, it's going to be our gastrocnemius that's going to tighten up and tighten. Next, we have the soleus. Again, it's going to be deep to the gastrocnemius, so that's going to be the location. The location of this is right on the back of the calf, right? And it's also going to be superficial. And now the soleus, it doesn't have any particular heads, but it does have an origin that's going to be at the proximal portion of the tibia. So again, we're talking about it's going to be near the tibia here, and it's also going to be have a origin that's going to be near the fibula as well. So tibia and fibula, of course, they have a connection here, and that's where the origin for the soleus is going to be. And then as far as the insertion, again, the Achilles tendon. Okay, Achilles tendon. And what's the purpose or action of the soleus? Ankle plantar flexion. So both the gastrocnemius and the soleus do ankle plantar flexion, but it's going to be mainly the gastrocnemius that does knee flexion. So let's go ahead and get those visuals. We'll also go back and see the movements for the hamstrings as well. So let's focus on extension of the thigh at the hip joint. Remember, it's only going to be the long head of the bicep femoris, the semimembranosus, and also the semitendinosus that can do this movement. All right, extension of the thigh at the hip joint. Next, we're going to be flexion of the leg at the knee. So that's going to be all of the muscles of the actual quadricep. Here we go. So they're going to be anterior, but we're seeing the posterior version of this. Remember, that's going to be the short and long head of the biceps, the semimembranosus and the semitendinosus. Medial rotation of the leg at the knee. This is only going to be semimembranosus and also semitendinosus that can do this. There we go. We see that we're going to have medial rotation of the leg at the knee joint. See that again. There we go. It's going towards medially. And we also can have lateral rotation of the leg at the knee joint. And this is going to be different. So if you're doing medial rotation, semimembranosus and semitendinosus. If you're doing lateral rotation, you're only talking about the short and long head of the bicep femoris. Let's see those. So lateral, bicep femoris. See that again. Medial, semimembranosus, and semitendinosus. Let's do that again. Semimembranosus and semitendinosus, medial rotation of the leg at the knee joint. Lateral rotation is again the bicep femoris. Okay, back to what we were actually talking about, because I know I forgot to show you that note. But we have the gastrocnemius here. As you can see, that's going to be the large two-bellied calf that's on the back of the actual leg here, or the back of the lower leg. And we're going to be looking at plantar flexion of the foot at the ankle joint. Now remember, both the gastrocnemius and the soleus do this. Ankle plantar flexion. Both of them do this. But we're not able to see the soleus because it is deep. So raising our calf. Not raising our calves, that means we're planting our toes into the actual cement or whatever this person's standing on. Maybe they're standing on carpet. Who knows? Okay? Now let's talk about the flexion of the leg at the knee joint. Remember, this is only going to be the gastrocnemius. Here we go. All right, folks. So let's go ahead and move on to the next piece of. So we're back, and I also just want to show you this same slide, except it has more details for the gastrocnemius and the soleus because they are in bold. Now, we already went over them, but of course, this is just another way to see. Okay? So we have the posterior, medial, and lateral condyles of the femur. We have the proximal portion of the tibia and fibula, and the interosseous membrane when it comes to the soleus. I want to see if I can find a better visual of that too. I got a visual of the gastrocnemius. I just want to kind of show you where the actual origins are. Because sometimes it just looks like, oh, it's a big piece of muscle, the two belly muscle, but we actually have origins here as well. Sometimes it's hard to see. So the origin is going to be the medial and lateral condyles of the femur. And so we can see our femur here, and again, our femur is going to be connected through different ligaments to our tibia and fibula, but we also have those connections of the actual gastrocnemius. Now let's go ahead and look at our soleus. Let's see if I can find I'll go to like a deep visual of this. See it better. If they allow it. Sometimes it's a little bit harder. Well, I can see it better. Our soleus, as you can see, it's going to be at the, again, the proximal portion of the tibia and fibula. Also, it's going to be connected to some kind of interosseous membrane, which we know is going to be membrane on the bone itself. I don't know if you can see that there. But as you can see, here's the gastrocnemius, here's the soleus, and it's right underneath it. All right, folks. So hopefully that helps with visual as well. Again, the lab is going to be like your best friend at this point. Let's move forward, but first let's look at all the stuff we've done already. We've already done vastus medialis, rectus formis, gracilis, semitendinosus, gastrocnemius, soleus, and biceps femoris, and we also did gluteus maximus. So we only have a couple left. Let's move on. We're down to our last bit of muscles. As you can see, we're down to the tensor fasciae latae, and the extensor digitorum longus, and the sartorius. Okay, so the only thing we have to know the origin, the insertion, the action/function, and location of is going to be the tibialis anterior. Everything else, we just need to know the location. Let's get ourselves oriented. We have posterior views here. Okay, we can see our knee, and we have the lower leg. Make sure my accent's not ruining anything. This is going to be our tensor fascia latae. Okay, again, I said latae because as soon as I see T-A-Y, I'm like, Tay. You know what I mean? I always have to get the phonetics of different words. But tensor fascia latae, okay? Or latae, whatever you want to say. Make sure you just know at least you can locate it. All these muscles on the actual visuals we have here. We have the tibialis anterior, the extensor digitorum longus, which we know is different from the extensor digitorum. That extensor digitorum had to do with the forearm, and of course the metacarpals of the fingers, and this one's going to have to do with the lower leg, and of course the digits or the toes. Okay, and we also have our tibialis anterior here as well. We have our sartorius muscle here, and we have our, where's the other one? Sartorius, center. Oh, well, yeah, it's the tensor fasciae latae. Okay, now you see this one's is fascia and this is fasciae. Sometimes you'll see either or, but tensor fascia latae. Okay, it's on the sartorius first. As you can see, it looks like a little strap. And this little strap is going across, it's like a thin band that's going across the outer hip to the inner knee. So it's like our hip to our knee. That's going to be our sartorius muscle. Now, what's the whole goal of this or the action of it? It's to flex the knee, also to abduct or rotate the hips laterally. Okay. Next, let's focus on our extensor digitorum longus. So we have the extensor digitorum longus muscle right here. We already know it's going to be long, and we already know it's going to be connecting to what? Our digits, our toes. So it's really going to help our toes extend, okay? And also it's going to be on the front lateral shin. That's where the location is going to be. So really it's going to be a shin. It's going to be used for shin dorsiflexion, which is moving the foot toward the shin. And also it's going to help with, well, it's not going to help, but it also can spread or extend the toes, spread the toes out. So yes, it goes down and goes to your toes, mainly the 4 carpals 2 through 5 here. Okay, and it's going to help spread your toes out. That's the whole goal. Now location, again, top of the foot. Sometimes when you actually start spreading your toes out, you can see this at the top of the foot. That may be easier for you to locate just by doing the action and remembering that it has to do with extensor digitorum longus. We'll also see a better location when we get another visual. Now let's go ahead and look at our tensor fascia latae, which is going to be this muscle here. As you can see, it definitely is going to be a part of that iliotibial band. Now we will see a little bit of details of next. Okay. So what do we see here? We see our tensor fascia latae there. What else do I notice? It's kind of like a part of this side hip pocket. So it's almost like the front of the hip bone, but on the side of it a little bit. That means it's probably going to help with abduction and help rotate the hip, and also stabilize the knee because it does go down here to where the knee is. And we did just say that it has to do with the iliotibial band, which means that it's going to help stabilize the hip, stabilize the knee from the hip down to the tibia. Finally, we have our tibialis anterior. So we're going to be a larger one here. Okay, and as you can see, it's going to be the anterior shin. So when you see you basically flex your foot towards your shin, you can feel your shin going in, and there's also going to be a muscle right next to it. That's going to be your tibialis anterior. Okay. Now let's get into the origins of all this stuff and talk about more of the actions. Like for tibialis anterior, it's going to be a part of ankle dorsiflexion, and it also is going to be a part of ankle inversion. Okay. On our tibialis anterior, again, this is going to be the anterior view. We have our layer of someone's lower leg. And then next, we're going to take away that layer, and we will be able to see the tibialis anterior. As you can see, if you have your shin bone here, tibialis anterior is right next to it. Also going to be, one of the actions is going to be inversion, and it also helps with shin or ankle dorsiflexion. Okay, so extending that foot toward the shin up. Let's talk about the origins. The origins here is going to be the lateral condyle, or you can also say the upper 2/3 of the tibial shaft. Also going to be an origin where it's going to be around the interosseous membrane of bone. And finally, again, think about the condyle of the tibia here. So again, the knuckle end of the tibia, and the upper 2/3 of the tibia shaft is going to be that whole origin piece. Okay? And then the insertion is going to be the medial tarsal, right here. And then also the first metatarsal, which is going to be your big toe. Location, anterior shin. Now let's go ahead and see if we can see some of the other muscles. I want to show another view of the tibialis so we can definitely see what we mean by the origin being. Let me move this out a little bit. So here's our tibialis. As you can see, here's our shin bone. It's basically going to be that bone that's going all the way down to the tarsal and the metatarsal, the first metatarsal. But if you go in and you try to look for the actual origin, you'll see that it is a part of the condyle, the knuckle portion of what? Our tibia shaft. If you go back down, we see it's going to be the upper part of that tibia shaft, the upper 2/3. And then, of course, it's going to be attached to the interosseous membrane as well. I want to just show you that. Show you the tensor fascia latae, okay? As you can see, it's on the upper hip here. And one of the main things we said about this is that it's going to basically tense with the iliotibial band here. So you see it goes all the way from hip down to the knee. And that tensor fascia here, latae, is going to help with that. Okay? And this is also what helps the hip abduct or rotate. And it also helps stabilize the knee because that's the IT band, or the iliotibial band is going to help stabilize the knee as well. We have that sartorius muscle. Again, we said it's like a strap across the thigh. Okay, it's like a thin band from the outer hip going into the inner knee. Okay, that's going to be our sartorius muscle. Very, very thin. You can also see the origins up here. Has to be by the actual ilium in some kind of way. And the whole purpose is to flex the knee and, of course, abduct. And it also helps with rotation. Let's move on to the extensor digitorum longus. Our extensor digitorum longus. Okay. And right from there, all the way down to our digits here, digits 2 through 4. That's going to help those toes spread or extend. And also helps with dorsiflexion. See, it is right next to that tibialis anterior. Tibialis anterior, extensor digitorum longus. Boom. And that makes sense because they both have similar actions in the fact that they both are going to help with ankle dorsiflexion. All right, so we have our tensor fascia latae, and we also have our tibialis anterior here. We're going to have our extensor digitorum longus again. And then finally, we're going to have our sartorius muscle, band that kind of wraps from the hip to the inner knee. And this should help you with location as well, because if you have a model that looks similar to this, then again, you'll be able to say, okay, sartorius, location, you know it's going to start from the hip, it's going to end at the inner knee. So I can automatically say that my location for that is going to be the outer hip to inner knee. There you go. For the extensor digitorum longus, like we see here, you can automatically say the location is obviously going to be the front lateral shin. Okay, front lateral shin. And then we know that the tibialis anterior is going to be the anterior portion, right? The anterior shin. So lateral to it is going to be that that extensor digitorum longus. And then finally, we have our tensor fascia latae, and that's going to be basically a portion of the iliotibial band, which we'll talk about next. It's going to be basically, you can say it's a side hip pocket, front of the hip bone, whatever you want to say to help you with that location there. All right, folks, let's see if we're missing anything on our slide. We are good. We have our tibialis anterior that's going to be highlighted here because it is in bold, and we got through all the muscles of the pelvic girdle, the hip, and the leg. The next video, we're going to get into muscles, or other, meaning the other structures that are on our muscle list, And we'll finally talk about intramuscular injection and also muscle strain. See you there.